Hi, we'd like to welcome everyone to today's webinar, Dentistry in the New Normal. Just a little bit of housekeeping. If this is your first time using GoToWebinar, you can call in and listen either using your microphone and speakers or by telephone. We're also going to be taking questions throughout. There's a lot to cover in this topic, so feel free to type your questions in. Hopefully we'll get to answer as many of them as we can. Whatever questions we don't get a chance to answer, we'll make sure that we send those questions to the panelists and someone will get back to you afterwards. And today on our panel, we have Paul Freed. Paul is a member of the firm and a licensed certified public accountant in New Jersey and has practiced accounting for more than 30 years. We also have John Szczomak. John is a member of the firm and a licensed certified public accountant in New Jersey and has been practicing public accounting for more than 23 years. And from Smolin, we also have our moderator today, Henry Rinder. Henry is a licensed certified public accountant in New Jersey and New York with more than 30 years of public accounting experience. And today we have with us our special guest is Chuck Cohen. Chuck is a managing director and third-generation owner of Benco Dental Companies, the nation's largest independently owned dental distributor. And with that, I will pass things on. We have a little disclaimer and pass things along to Henry.
Thank you very much, Amanda, and good morning to you all. We appreciate you joining our webinar this morning, and I'm thankful to have Chuck joining us. We were looking for someone that actually understands the needs of the dentistry dental profession in COVID-19, and we think we found just the right person for it. And joining me again is Paul Freed and John Szczomak, who both my partners, but also who specialize to a great extent in serving medical and dental profession, and surely they have years of experience in dealing with the complexities of those professions in terms of dealing with different problems and circumstances. So we're gonna tee off by having Chuck make a presentation on his views of how best to address the COVID-19 circumstance from a dental profession perspective. And then we'll go to a couple of exchanges between me, John, and Paul to discuss some of the financial and tax ramifications that are affecting the dentistry. Chuck, the floor is yours.
Thank you, Henry. Nice to meet you, and thank you very much. I'm flattered to be here. Amanda, if you could go back one slide. I don't want to gloss over the disclaimer, not because, normally we all gloss over disclaimers, and I get it. It's that thing you have to agree to at the bottom of the iPhone update, But I do think it's important to just note that things are changing in this category very quickly. In fact, as we sit here this morning, you may not realize it, but yesterday on the Senate floor, what there was of the Senate floor, Senator Susan Collins from Maine spent a fair amount of her time questioning the CDC, specifically talking with the CDC director about guidelines for dentists, which was kind of interesting to me. I really didn't know that Susan Collins, who's up for re-election, had a lot of passion around dentistry. Clearly, the ADA is out lobbying and talking and wants to make sure that dentistry is safe and supported, and it's viewed as an integral piece of the healthcare picture in the United States. So I do want to say that what we're going to talk about today, what I'll present to you today, is really the best thinking that we've come up with to this date, knowing that on Monday morning next week, something may come out to change everything around. So I do think it's important, whether it's the financial and tax accounting implications or how to run your practice or the CDC's recommendations, what we're going to present today is our best thinking to this point, knowing that this is a very fluid process. Things are going to change very quickly. So Amanda, if you can go to the next slide, that'd be great. This is not a video call, it's an audio call, but if you looked at me, you would know that I've been in dentistry for a long time. Personally, and my family's been in dentistry for 90 years. We're a third-generation family business. Personally, I've been in dentistry since the late 1980s. So this is, as we say, not my first rodeo. I do intimately remember what it was like to go through the bloodborne pathogen challenges of the AIDS epidemic of the early 1990s. And on the slide, you'll see this very famous, well-known People magazine cover from 1991. If you're not familiar with the story, you're too young or you don't remember, the AIDS crisis had dentistry very much at the center. it was a very tragic story. We didn't know it at the time this People magazine cover came out, but there was a doctor, a dentist in Florida named Dr. Acer, who had AIDS and deliberately infected his patients with AIDS. And later people sort of surmised he passed away, and this woman, Kimberly Regalis, passed away as well. Later people surmised that he was trying to gain public awareness for a crisis that he thought was undercovered and underrepresented in the popular media. Leaving that aside for a minute, if you go back to the AIDS epidemic of the early 1990s, dentistry was very much at the center of AIDS thinking, you know. So what we saw was this whole idea of you could go to the dentist as a patient and come out with AIDS, right? It was a very, very real fear on the part of patients and of practitioners. So what did we learn from 1991, those days, and what can we apply to today's challenges, and what's the same and what's different? So a few things. First of all, not to state the obvious, but in the early 1990s, we were dealing with bloodborne pathogens, and now we're dealing with airborne pathogens. So not a big surprise. We need to handle airborne pathogens differently, than bloodborne pathogens, but there are a lot of similarities. The second one is dentistry, as I noted, was very much at the center of the AIDS crisis epidemic of the early 1990s in the popular culture. Today, we're mostly talking about China and bats from Wuhan and things like that. So dentistry is not at the center of it, although that could change tomorrow. If there is an outbreak in the United States that's tied directly to patients visiting a dental office, that'll change the entire calculus here. But for now, dentistry is just a player, but not the center of this issue. At the same time, there are some common themes. There's a lot of fear, there's a lot of confusion, and as of yet, there is no cure. So there's a fear that if I, as a patient or a practitioner, get COVID-19, I could die, or at least be incapacitated for a period of time. And that is in a way very similar to what we saw in the AIDS epidemic of the early 1990s. So this is not our first rodeo. This too will pass. We will figure it out. On the right-hand side of the page, you'll see a little bit about Benco. I'll just say that our goal, our mission is to drive dentistry forward through our innovative solutions and caring family culture. So one of the reasons why we jumped on this is because we only focus on dentistry. We are third generation family business dental people. I am not a dentist. Very few people in my family have been dentists, but I feel like we're part of the profession. And figuring out how to help our customers and dentistry overall get through this challenge is a key driver in all of our actions over the past 6, 7, 8 weeks. And when dentistry is under siege, then we're under siege. And so it's very important to us to get this right. If you'll go to the next slide, Amanda. So as a way of level setting on sort of the changes that we're looking at, let's first talk about the past. What was a dental visit like, or a dental practice like in the past, which at this moment is March 1st, right? So it's not long in the past. And what is a dental visit and a dental practice going to look like in the future, which probably is July, August, September. So we're not talking about the 1950s here. We're talking about the immediate past and the immediate future. But it's an important level set to make sure that we all understand that dentistry will need to change in very substantial ways in order to deal with the COVID-19 challenge and the challenge overall of airborne pathogens. So in the past, we saw dentist's office had a welcome space, a reception area that made patients feel comfortable and relaxed. Going forward, we need a welcome space that makes patients feel safe. In the past, it was all about an office that was focused on preventing cross-contamination and bloodborne pathogens. Cross-contamination meaning, how do I make sure that the germs and bacteria from one patient don't end up in another patient? That was the challenge, cross-contamination. Now we're dealing with an office that's focused on preventing cross-contamination, bloodborne and airborne pathogens. We're not going to deal with bloodborne pathogens, but we do need to deal with airborne pathogens. Number 3, patients were nervous about pain. Going forward, patients are going to be nervous about pain and their own safety and viruses. Number 4, team members are concerned about the health of the patient. Now team members are concerned about their own health. And if you're listening to this call, maybe you are as well. A lot of dentists are over the age of 50. They're male. They tend to be in groups of demographic groups that are more likely to have a hard time fighting COVID-19. So you on the phone may be very interested and concerned about your own health. In the past, we had an office designed primarily for efficiency. We need to have an office that's designed primarily for safety. In the past, we had team members who arrived at the office dressed in scrubs or who wore lab coats over street clothes. Going forward, we need team members to wear street clothes to the office change into scrubs and shoes at the office, but basically what's worn at the office stays at the office. In the past, we had a team that was loose on universal protocols, OSHA regulations, and/or personal protective equipment, or maybe got a little loose because it hasn't been that important lately. Going forward, we need a team that's has tight protocols on infection control, OSHA, and PPE. It is no longer allowed to say, well, I just don't understand or I don't know. Going forward, every dental office needs to feel like they have tight protocols around infection control and other related issues. In the past, we had a waiting area with a check-in and check-out station. Going forward, maybe not immediately, we're going to need a virtual business area because patients don't want to sit in a waiting room and be potentially affected or infected by COVID-19. And in the past, we had a full schedule. Dentists were cranking and busy in January and February. Going forward, we're going to have some open spaces. There will be some spaces that are difficult to fill. And at least at first, it's going to be a while, we think, before every patient goes back to reappoint. Next slide, please. So what does it look like to reopen your practice? Presumably everyone on this call spent the last 6-8 weeks under advisement / requirement by the federal government and the ADA to close their practice except for emergencies. At Benco, we saw 80% of our business go away, which was pretty much what we expected, considering only 20% of dentistry is considered emergency. So 80% of the business went away. So we all went to suspended animation for 8-9 weeks. Now it's time to restart. So what are the things that as practice owners we need to do to restart our practices? Well, it starts with rehiring and re-engaging your people. And that's worthy of a few minutes of conversation, or at least thinking. At Benco, we've got a whole HR department, and pretty much all we focus on is rules and regulations. For most of us on this call, I would assume this last few weeks may have been the first time you've ever had to think about accessing unemployment, either yourself, if you're a staff member, or if you are or a doctor who had to use unemployment because you couldn't pay your people for 6, 8, 9 weeks while your practice was closed. Putting people on and taking people off unemployment is a very local issue. You do not want to run afoul of wage and hour issues. So the first thing is know your local laws and regulations. Your friends at Smolin may be able to help. We've got some other ideas as well, but you don't want to be cavalier about the rules and regulations around unemployment compensation. It's probably a really good opportunity to revisit and or upgrade your HR processes and employee documentation. You will have childcare issues going forward. As far as I know, every school in America is closed. So your team members are now teachers as well. They're doing homeschooling. And so childcare and covering for children and childcare issues will be important to your team members. And then if you don't already have paid sick leave, now is a great time to offer it. You do not want to have a situation where someone doesn't feel 100%, maybe because they have COVID, maybe because they don't, but you don't want them coming to the office and infecting other team members or staff members or patients. So please make sure that you have paid sick leave, and if you have not offered it as a benefit to your team, please, it's a good time to do that. On the right-hand side, we recommend Bent Erickson. Bent Erickson is a dental-oriented outsourced HR provider. We think that they offer a great service for the limited amount of money they charge. At Benco, we're happy to sign you up or do anything we can to help you there. But it's a very low investment to get some help on your HR side to ensure that you do not run afoul of wage and hour laws. It's very expensive. Even just if you're just getting investigated, it's an expensive proposition to have somebody blow the whistle, or for some reason for you to get on the radar screen of local regulators on wage and hour. So as you move people on and off unemployment, you want to make sure that you are absolutely within the letter and the spirit of the local regulations for your area. Next slide, please. Number 2 is it is time to tune your equipment if you haven't started things up again. I don't know, in my house, we've got 2-3 cars in our garage. We haven't really run them in the last 8 or 9 weeks. The worst case scenario, in my opinion, is you've been closed for 8, 9, 10 weeks, 12 weeks maybe, and you go put now you have a fully loaded schedule, and on day 1 around noon, your compressor seizes up because no one's run it in the last 12 weeks. For most of us on this call, the time that you've been closed will probably be the longest period of time that your equipment has not been run since you opened your practice, right? So a week, 2 weeks maybe because you're on a cruise. 8, 9, 10, 11 weeks is a long time. So we really recommend bringing in a professional technician to run all the equipment, make sure everything's working right, check the gaskets on your autoclave, make sure to shock your water lines to get rid of all the bacteria that's in there, whatever it takes to get everything up and running. You can do it yourself. It's more efficient, we think, to bring in a professional. And we recommend that, hopefully a Benco service technician. If not, then whoever your normal service technician is. We do recommend that it's done no more than 48 hours prior to opening your office again, because you don't want the buildup of biofilm in your lines to take place while you're waiting. So get that equipment tuned up, make sure that you don't have an oops day where you have to cancel day 1, day 2, or day 3 because your vacuum, your compressor, your suction, whatever it is, seizes up while you're back to work. Okay, next slide, please. Number 3 is to make your team feel safe. This is a really important issue. We'll talk for a few minutes about this, and there's a deliberate reason why I started by number 3 on the list is make your team feel safe, not your patients first. We will talk about the patients in a few minutes, but we believe that your patients won't feel safe until and unless your team feels safe. If your team feels safe, they will make sure that your patients feel safe. But safety is important going forward. Nobody wants to take their life into their own hands to go have a dental appointment, or to go work in a dental practice. So we do have a list of suggestions as far as making your team feel safe. Amanda, if you'll advance the slide, we'll walk through them. So the first thing on the list, and in my opinion, the most important one, is to appoint a safety czar. If you take away nothing from this presentation other than this point, then we'll consider it a success. Going forward, we all need to create a safety culture, right? A safety culture means safety is job one. Whenever you go visit a manufacturing plant or a medical practice or a hospital, safety is primary. If people don't feel safe, whether they're working in the office or they're a patient there, it doesn't matter what else goes on there. They're not going to feel it was a good place to be. If you think back to your Psych 101 days, you'll remember probably Maslow's pyramid. Maslow's pyramid is 6 layers of needs, the needs of human beings. At the base of the pyramid is physiological needs. That's the need that we all have as animals: to eat, to sleep, to go to the bathroom, all of our basic physiological needs. That really enters into dentistry because pain is on the bottom list. So that's why a patient in pain might pull his or her own tooth just to relieve the pain. A patient in pain doesn't care about safety. A patient in pain just wants to get out of pain. But getting away from patients in pain, what you see is that the second layer in Maslow's hierarchy of needs is the need for safety. If we don't feel safe, we are not going to do whatever the activity is. If we don't feel safe, we're not going to visit the restaurant. If we don't feel safe, we're not going to go to a movie theater. We're not going to go to a baseball game. We're not going to go to Target. We need to feel safe. And the same thing is true in a dental office setting. So what do we do to create a safety culture? How do we create a safe environment? We believe it starts with appointing a safety czar. Now, that might be a dentist. It might be you. It might be another team member. It doesn't really matter who it is, as long as it's one individual whose job it is to make sure that they are the expert in the office on safety. They have read the regulations. They're familiar with them. They have the books, they know where to find them, and they know where to look stuff up on the internet, and they are the safety czar. And the second thing you need to create a safety culture is an old tool that was invented in the 1950s at Toyota, the car manufacturer, called an andon cord. So basically, if you think about a car manufacturing plant is a very expensive operation, and there's a lot of people. If you remember back to the pictures you've seen of Henry Ford's original assembly line, it's not much different from that, but I'm a worker on the assembly line, and I put on the wheel or the fender or the bumper, and I screw it on, and then the car, which is in process, moves on to the next person, and the next person does their job. So what did Toyota do? Toyota invented in the 1950s this concept called the andon cord, and it literally was a cord. It was a cord that hung down from the ceiling. Every worker on the assembly line had access to an andon cord, and every worker on the assembly line was empowered to pull the cord and stop the assembly line at any time they saw an issue with quality, right? So if I was a worker on the assembly line and there was a quality issue that was standing in the way of me doing my job to a level of quality that Toyota expected and I expected in myself, My job is to stop that line. Now, as you can imagine, stopping a production line at a Toyota plant or any car plant is a very expensive process. Normally, before the end on court, people would get yelled at, fired for yelling and screaming about quality. But the way that Toyota came out and really upgraded the level of quality, the way they raised their game with quality, was putting everyone in charge of quality, making giving everyone an end on court so that any individual on that assembly line could pull the cord, stop the process, and address the quality issue. We think the same thing is true in your dental office. If anyone in your practice feels that there is a safety issue, something is happening in the office that is putting patients or team members at risk, we need to empower those persons to figuratively pull that end on cord, stop the process, get the safety czar and say, this is an issue, we need to take care of this now. Now, this issue is the most important issue for our practice to figure out before we go on and do anything else. Safety is job one. The and on cord empowers your team, and the safety czar, whether it's you or someone else, is empowered and responsible to make sure that safety is the most important thing that we do in our practice. Without that level of process and responsibility, you're just not going to be able to build the safety culture you need to, in the short, medium, and long term, enable team members and patients to feel safe in your practice. Number 2 on the list, engage in honest talk with the team. Here's what we're dealing with. Here are the changes we're making. Team members need to know that safety is important. This is not something that should be swept under the rug. Honest talk is what's important and what's vital. Tighten your current universal protocols about cross-contamination sterilization. You know, frankly, we've gotten a little loose. Every year I visit over 100 dental offices, and I think honestly, safety and cross-contamination has been sort of less important the last decade or so. Now is a great time to go back, find those protocols, dust them off, make sure your OSHA guidelines are being adhered to, create and polish your standard operating procedures for morning and evening. Make sure that you are operating in a safe environment. Implement pre-appointment screening process as determined by the ADA. We have that form in a handout you'll get later if you haven't seen it already, but the ADA is strongly recommending that all patients be pre-screened for potential COVID. Ensure every member every team member has received their seasonal flu vaccine. Also a recommendation by the ADA. Everything that's in the operatory on a countertop that doesn't need there, put it away. It's just a place for germs to collect, but declutter your operatories. Upgrade to a regular ongoing deep cleaning service. We define a deep cleaning service as they come in and they fog with disinfectants on the weekend, but basically, if you have Mrs. Jones who's been there for 100 years and she comes in every Wednesday and empties the garbage cans, that's probably not enough going forward for a cleaning service. I'm not saying you need to upgrade to the most expensive cleaning company in your area, but it's something that should be addressed, and maybe you want to add some cleaning horsepower and firepower behind what you're currently doing. Everyone's going to need tighter clothing protocols. Whatever you do, whether it's disposable or not, everything that's worn at the office should stay at the office. We're recommending a healthcare grade laundry service and uniforms that can be changed during the day if they get soiled. I will tell you, getting disposable gowns is going to be very difficult for the next month, 2 months, 3 months, because there's a huge demand and not enough supply. So you probably need a cleaning service protocol around uniforms and scrubs. Rethink the setup and tear down of your operatories to ensure you've got enough time for disinfection, and you may have to adjust your schedule accordingly. If the kill time for tuberculosis is 10 minutes, then make sure you give 10 minutes to the chemical to work before you're using the operatory again. That will require some getting used to. You want to address the chairside ambient air quality issues. This is the biggest unknown in dentistry. We're struggling along with it as everyone on the call is. There are no clear answers yet. I know that's probably what somebody's going to ask is, what should I do about air quality? We think it comes down to some sort of machine for ambient air quality, better filters on your HVAC, and probably some sort of disinfection and turnover process for the rooms. Some sort of a suction system at the oral cavity so that you're actually sucking in the aerosols when they're produced. A higher level mask and PPE and face shield so that the practitioners and hygienists do not take in any germs that come out through their own body. Probably some sort of a dry shield or Isolite or similar product. So it's definitely a moving target. We're not quite where we're going to be in a couple months, but let me give you a few suggestions for today. Number one is Make sure your team is trained and retrained on proper suction technique if you're practicing four-handed. Number 2 is add a dry shield or similar to your armamentarium. Number 3, that's a chair-side oral cavity suction system. Number 3 is upgrade your HVAC filters to the highest quality available, and then watch for new products as they come out. During the moving on. What is your strategy around COVID-19? Are you going to test your team members? Are you going to test your patients? How will you handle a positive test? The ADA is sort of struggling with this because, frankly, in New Jersey, I believe that dentists are not qualified to give COVID-19 tests. That probably will change, but at this moment, I don't believe dentists in New Jersey, as far as I know, only in North Carolina are dentists actually licensed to give COVID-19 tests. But what will you do? Will you test everyone? Will you just do temperature checks? What will you do if patients or team members do test positive? Now is the time to think about that. And then finally, you need an OSHA-approved plan around N95 masks. So it's very hard to get N95 masks right now. We're struggling with that, but when you do get them, and you will in the next few, hopefully, weeks, you need a fit test protocol, a physician review, and documentation. You can read about that at the ADA website. Do not ignore those protocols. The reason why behind them is the N95 mask is a much higher level of filtration. And if you have a staff member who has an existing lung condition, the N95 mask might restrict their breathing to the point where they have trouble getting enough oxygen in their system. So people are saying, well, why about this regulational thing? The why is if someone with a breathing or lung issue does start wearing an N95 mask, they potentially could put themselves in more danger than if they didn't wear it. So that's why the rules are very clear from OSHA that everyone who is required to wear an N95 mask must go through a fit test and a physician review, and documentation must be on staff in your office before you implement N95 masks. So during dental care, use the highest level of PPE available. I could sell out today if I could get N95 masks at Benco. We just can't. There is a lot of counterfeit out there, so be careful. We don't sell counterfeit. So if someone says they have N95 masks and they sound too good to be true, they probably are. You want to use the highest level that you can find, face shields, disposable clothing if it's appropriate for the patient. You want to glove and deglove in the operatory. You want to pre-treat every patient with an antimicrobial rinse, probably 1.5% hydrogen peroxide or similar. Time to break out your rubber dam clamp box, the one you put away in dental school. Nothing works like old-fashioned rubber dam to keep the infection control, keep the patient's saliva in the patient's mouth. So it's now a good time to revisit your rubber dam skills. Make sure you're practicing with high volume suction, four-handed dentistry, reusable sutures resorbable sutures where possible. And finally, in hygiene, I'm sorry to say that, but for the time being, probably it's time to put away the ultrasonics and air polishing units. That makes me cry because I know they're much more efficient, and revert to hand scaling, at least for the time being, until we figure out the aerosol problem. And I don't think that's a big surprise. And after dental care, you want to clean and disinfect the operatories as per your universal protocols. And of course, disinfect your incoming packages before you open them up. If you could go back one slide, Amanda. So on the right-hand side, you see a little, there are firms out there that will give you an OSHA checkup. I firmly recommend it's a great time to revisit your OSHA protocols. Make sure you're not falling behind. There are going to be new protocols and new requirements ongoing as you go. So let's not be loosey-goosey on the ones that are already out there. That's part of building that safety culture. You're going to need better and higher PPE. That's not a big surprise. You're going to need a N95 fit test kit, or you'll need access to one. Antimicrobial mouth rinse, probably some new rubber dam forceps and clamps, higher level disinfectants, air quality solutions. We're not sure what those look like yet. We're working on it. Thermometers and COVID-19 tests. So you can talk to your Benco rep about that if you'd like. We sell those, and we're happy to supply. Next slide, please, Amanda. And then the next slide after that. All right, so next, after you've made your team feel safe, it's a great opportunity to make your team feel valued. It's been a lot in the popular press. I don't want to scare anybody, but I would say that we've seen a fair amount of research that shows that dentistry, especially in light of COVID-19, is one of the most dangerous professions in America due to aerosols, due to air quality, airborne pathogens, bloodborne pathogens, and just the simple hard work of practicing dentistry. with all the contortions, muscles, bones, all the things that we do as when we practice, when we take care of our patients. It's a great time to make your team feel valued. I'm of the opinion, I know times have been tough and raises may be hard to come by, but this might be a good time to put that incentive in place that you've been talking about. If the team wins, everybody rises or falls together, but nothing says love and respect like an incentive plan where people can make some more money. It's time to rethink maybe your team and business space to make it more comfortable and align with current protocols. We'll talk about the reception area in a few minutes. Nothing says love and respect more than team training. It might be a good chance to send your team away and help get them trained up. Personal schedules will need to be accommodated in light of childcare issues, and this is a good time to revisit that. And you may have to slow your office schedule in the short term to accommodate room turnover. You don't want to try to run at 90 miles an hour like you were in January and February, when in fact things take longer and it will take a longer time to get up to speed. The best example I can give you of that, I think, in my mind at least, is I remember 9/11, horrible, tragic day. You may remember it as well. And then I remember that as we in the United States put in higher levels of higher protocols around safety in airports, it took longer to get through security. I missed a plane one time because it took 2 hours in the Denver airport to get through the security line. And we all thought, oh my God, how are we going to fly? This will be something we'll never get over. And yet here we are 20 years later, and it takes less time today than it did in September of 2001 to get through security, because we developed systems, practices, protocols so that we can get through security faster. Well, the same thing is going to be true in dentistry. As time goes on, it won't take that long. Over the next few months, we will be able to get back. I'm very confident we will be able to get back up to the speed we were before in turning over the rooms and practicing dentistry. It just will take a little bit of time and learning and process, right? At Benco, we can help you redesign your business and reception area. And we do sell Herman Miller furniture, which is built for the healthcare environment. Very important. Most of us have waiting room furniture that's just a germ fest, right? It's fabrics and it's hard to clean and maybe it's kind of old. Now's the time, everywhere in your office, you want to have healthcare grade. What does that mean? It means there is no porous surfaces. Everything can be cleaned. It comes with a long warranty, and the materials are good enough to withstand ongoing disinfection with harsh chemicals. So very much recommend Herman Miller or similar for all of the furniture in your office to make sure that you are healthcare grade. Next slide. One of the things that makes this adventure and challenge in dentistry different than the bloodborne pathogens is that we now need to address what happens outside the operatory as well as inside the operatory. So if you think about it, bloodborne pathogens, because it was blood, really only had to worry about the sterilization area and the operatories themselves. Going forward, because it's airborne, we do need to start thinking about everywhere there's air in the office, and there's literally air everywhere. So one of those key spaces is the welcome space. Probably you've read most of these ideas before, so I'll go through them quickly, but some of them may be things you haven't thought of. You want to convert to digital and paperless where possible. Consider eliminating your reception with some sort of curbside check-in, pay by phone, patient escort. We are actively looking at solutions that will allow you to text your patient, check out online, but basically have a virtual business area where the patient does not have to stop at the front desk and check out. Sneeze bars at the front desk are getting popular. Pieces of plastic, that prevent people from breathing on each other. Eliminate magazines. You've seen that a lot. Add hand sanitizer. Enforce social distancing. Actually removing seats in the reception area. Talked about this before. Upgrading to healthcare grade furniture. Take every patient's temperature. Add disposable pencils so that people don't have to handle the same pen over and over. Wash your hands often in front of patients for 20+ seconds. Eliminate handshaking or hugging and adopt a hand in pocket protocol. And think about reducing traffic jams by mapping patient flow and adding signage around the office to make sure the patients know where to go so they're not inadvertently bumping into each other. In a perfect world, we should all be 6 feet apart from everybody. Well, in a hallway, that's difficult in a dental practice, but sometimes it's something as simple as a sign to say, hey, this is where you go for this. We'll just eliminate this idea that patients have to run into each other inadvertently. So we're very much of the opinion that if now is a great time to track the traffic flow of your practice, really thinking about how patients can move cleanly from their car, hopefully not even stopping in the reception area or welcome space, right into the operatory, get the work done, right out of the operatory back to their car without ever talking or interfacing with other patients or anybody more than the clinician who has to actually do the work. talked about this before. At Benco, we can help you with a redesign of your reception and business area. And again, Herman Miller Furniture is health grade quality, 12-year warranty, able to withstand harsh infection control protocols, and also has no porous surfaces. So you're not going to find it's not like carpet that's going to attract a lot of germs and bacteria. Next slide, please. Interesting. It's a very interesting time in dentistry. You want to make sure you're identifying and working with trusted sources and trusted resources. The folks at Smolin are a good example of that. I'd like to think the folks at Benco are as well. I want to read this. This is from a letter directly from the ADA last month from Dr. Kahani. With scientific evidence continually emerging on COVID-19, there are many gray market products, including testing kits, dental supplies, and personal protective equipment being marketed to dentists during this crucial time. There is no evidence of these products' effectiveness, but they may be advertised to you based on your online search history. Dentists beware, ensure that you are purchasing products from reputable suppliers. Chances are that if a product seems too good to be true, it probably is. Funny story, just this morning I got a text from my own dentist, and he said to me he had no issue with masks because he had 3M N95 masks. I will tell you that most likely those masks are counterfeit. We're seeing them all over the market. I'm not sure exactly where he got them. He didn't get them from Benco. He got them from somebody else who knew somebody who knew somebody. There's a lot of counterfeit product floating around out there. It does not work as advertised, or probably doesn't work as advertised. Now is the time to be buying from trusted sources, Benco, Patterson, Shine. Not a time to be ordering stuff from a marketplace vendor on Amazon that you don't know, that you don't have the confidence in. These products are life and death products, and you want to make sure that a mask that advertises it filters 95% of the bad germs actually does filter 95%. And it's really amazing how much stuff is out there that's not what it says it is. So purchase from reliable suppliers, beware counterfeit products, and follow CDC, the ADA, and other key sites so you're always up to speed on trusted information and you're not believing rumors. Go right to the source whenever possible. At Benco, we've got some special programs for customers. We do only sell products that we stand behind 100%, and we're happy to help you. We also have a great website, a great section of our website at benco.com, all with coronavirus updates. So we've been told that it's as good as what people are seeing out of the ADA. We keep it up to date all the time. So feel free to check that website out for some reliable information and sources. Next slide. Interesting. Now we're going to talk about what it takes to make patients feel safe, right? So I'm sure many of you thought we would start with that, but actually that's near the end. First, we have to bring our team members back. We have to make our team members feel safe. We have to make our team members feel valued. We have to clean up some issues around the operatories and the waiting areas and the business areas. Now, how do we make patients feel safe? Well, a couple things. First of all, there is a challenge. And for many of us, especially if you've been in dentistry for a while, this may be the first time in 20 plus years that safety is actually a concern. I remember what it was like in the early 1990s. People were very nervous about visiting the dentist. Dentists were nervous how they could deal with this issue. So safety is going to be a concern going forward, right? Let's recognize it. Let's embrace it. Let's figure it out. Let's not hide away from it. Second one is we predict no big surprise here. There's going to be three kinds of patients. There will be patients in pain. Patients in pain will come and visit the dentist no matter what. Don't worry about them. They will do anything to get out of pain. Then we're going to have patients who will quote unquote never return. Not never, but they're the ones who aren't leaving their house to go to the restaurant, to go to Target. They're just scared in general, and they are not going to venture out of their house almost no matter what. So they're not going to be the ones who appoint. But there's this big group that's left that we would call gettable patients, right? Patients who are concerned but can be convinced. They're the ones who are wise and knowledgeable and understand that, I don't have to spend the rest of the year in my house, but at the same time have concerns they want to make sure they're in a safe environment. Those are the patients who we have an opportunity with. Those are the patients who will understand when we explain to them all the steps we're taking around their safety. Those are the patients that we want to add to our practice. And the interesting thing is, if you and your practice are the best at getting those gettable patients, your practice is going to grow. If you're not good at it, your practice is, in my opinion, is going to shrink. So what can you do to get those gettable patients? Well, first of all, you want to screen patients for symptoms to make sure that they're not actually getting into your office if they have COVID-19. Delay care when appropriate, and that is the recommendation of the ADA. Proactively and consistently communicate that your office is safe, and we'll share some ideas around that in a minute. Ensure your team, especially the schedulers you have the skills to communicate with compassion and assurance. Answer patient questions before they're asked. Every patient has questions. They just may not ask them, but they've got them. So answer them before they're asked. An office tour is great because it's always better to show, not just tell. Here's the autoclave. Here's the sterilization area. Here's the air quality handler we put in place. Mrs. Jones, we are taking every measure possible to ensure that you are safe in our practice. That office tour it goes miles and miles and miles to create this idea and impression that you are running a safe operation. We offer teledentistry options and we encourage them. And then a social media plan to get the word out is really very helpful. We recommend that. We're going to give you some examples of communication tools that you can use. We do offer a service around building a different brand if you'd like. And then we do have customized coaching if you want to go that much farther on these issues. Next slide. So the next slide you're going to see, and we will give everyone these as handouts, is on the left, on this slide, we've scripted out a sample patient letter and or a script. You can take pieces of this and use it with your schedulers as they talk to patients on the phone or actually do a letter to your patients. Basically, here's what we're doing to make sure that you are safe in our environment. And you're going to get that. You can feel free to copy and paste from it as you wish. Next slide. On the left-hand side of this page is the actual sample letter that came from the ADA. I may be a little biased. I kind of like ours better, but feel free to cut and paste from both examples if that's helpful to you. But that's the ADA sample patient letter. I'm sure if you're an ADA member, you already received that. On the right-hand side, there's 3 examples of signs you may want to have around your office. One is a welcome space sign that talks about the precautions you're taking to prevent the spread of COVID-19. Another one is a front door sign that basically says go away if you don't have an appointment. We don't want to have unappointed visitors. And then finally, some sort of sign in the operatory that says here's what we're doing to keep our operatory clean and safe. And it just, if nothing else, sends a good message. It says this, you're taking this issue seriously. And then finally below that is, and I'm sure you got this already, the ADA patient screening form questionnaire, which was distributed a week or 2 ago, is repeated there so that your team uses the right screening questions with patients before they take appointments. And you want to make sure you do that right. You don't want to run afoul of any legal issues. If you are using the ADA's recommended protocol, then that's a pretty good way to make sure you're safe from any lawsuits. Next slide. Number 8 on the list, you want to make sure you're stabilizing your revenue. We all have revenue challenges over the past 8, 9, 10 weeks. Couple of ideas here, and I'll leave this to the Smolin team to really address. It's more their issue. You want to make sure your PPP application has been received, funded. It may be time to raise your fees and or add an infection control surcharge. You want to work with Smolin to figure out how many patients you need to see in order to get to a break-even number and marry that up with the available time in your schedule. Always good practice to have a fill-in list if you have a cancellation. Great time to collect your uncollectible accounts receivable, renegotiate with your insurance providers, get a practice dashboard. We recommend Dental Intel or DI. It's a very good system. We're happy to represent them at Benco, but some sort of a practice dashboard. And it's a great time to consider a Solea laser. I'll give you one quick deal. If you're considering a hard tissue laser, Solea is the #1 player in the market. 3 reasons why a Solea laser is a great practice builder at this moment in time. Number 1 is it creates less aerosol by a long shot than a traditional dental handpiece. Number 2 is it operates at a much higher temperature, so if there is aerosol, it's much less likely that COVID-19, if it's present, survives. And number 3 is because it's a laser, you can practice multi-quadrant dentistry, and therefore you don't have to change your PPE, which will get more expensive. So basically, you can do work in multiple quadrants in the same visit, which not only is more efficient for the patient, now it's more efficient and productive for you as well, because you don't have to change your gloves and your mask and everything as often. Right? Single visit dentistry. So a Solea laser is a great product to consider for your office. Talked about Dental Intel. We also represent Open Dental, which is cheaper probably than what you're using now if you're not using it. And as I said, the Solea laser is a great idea. Next slide. You want to watch for long-term changes. So looking out into the future, which probably starts in 2021, a couple of recommendations, couple of things to start thinking about. We're going to see long-term changes around ambient air, sanitizing, and disinfection. We're only in the first inning of this challenge. I am confident that we're going to have, we're seeing new products literally every week. The good news is that a lot of these products came from medical, so it's not like they need to be reinvented. It's just like we never paid any attention to this issue in dental, but certain medical professions did. So we're going to have some very, very good solutions for air quality and sanitizing and disinfecting in the next few months. So you want to watch for that. There will be updates and changes in the universal protocols and OSHA regulations. That's why it's so important to have a safety culture. The reason why a safety culture is important is if you have a safety culture, you can make changes as you go. You're not putting things in place that'll never change. A safety culture means at this moment in time, we are practicing at the highest level of safety that we can. And tomorrow, if something changes, our culture adapts, right? So as things change in universal protocols and OSHA regulations, you're going to be ready and ready to update. There will be changes in design. We view closed operatories as the way to go going forward. Open operatories are going to be a thing of the past. Smaller or different kind of welcome spaces and closed sterilization areas. There will be changes in federal and state regulations. I don't think anyone doubts that. In Pennsylvania, you may have heard for a week they were saying, the regulators were saying that dentistry required negative pressure environment. They backed down, and we don't envision that going to be something that holds going forward, but that was talked about for a while. And then we're going to see, we think, a stronger intersection between the medical regulations and the dental regulations, right? So what you're going to see is that dental, which has been pretty much under-regulated, not unregulated, but under-regulated over the past decades, probably the level of regulation in dental is going to rise up, maybe not to the level of a medical hospital, but certainly in general, you're going to see that we're going to see more regulations in dental than we've seen before. We do have some seminars to help, and we have Benco reps. Our job over the past 8 or 9 weeks has been to make sure that our reps are as trained as possible. They have the training that they need in order to answer these kinds of questions. So as things change, I'll be a little biased here and say the right person to ask is your friendly Benco rep. If that person does not know the answer, that person will help get you the answer, because that's key. You want to make sure you're up to date as things change. And as I said, things are going to change. This is not decided science. This is we are in a state of flux, and we're figuring out as we go. Next slide, please. And number 10 on our list is make sure you're smiling. This crisis is not the first one dentistry has faced. It certainly won't be the last. For those of us who went through the early 1990s, the bloodborne pathogen challenges, this feels very similar but different in that we're dealing with a different bug that's transmitted in a different way. But when it's all said and done, I am very confident that we will figure this out in a way that makes dentistry still a wonderful, profitable, rewarding profession to practice. I remember in the 1990s talking to dentists who said, oh my God, I cannot wear gloves. It's going to make the patients are going to be scared of me. I can't wear a mask. I can't afford 5 hand pieces. I mean, I heard every excuse there was. And guess what? We figured it out. We will figure this out as well. We will adapt, we will grow, and we will succeed. At Benco, we are proud to say that we've been serving dentists in dentistry for 90 years, and we're planning on doing it for another 90 years. So we feel that dentistry is a wonderful profession, and we are pleased and proud to serve the smile makers going forward. Next slide, Amanda. What you see next is a checklist. It's 2 pages. Amanda will distribute it after the program. That basically gives you a summary of all the ideas that we talked about here. So you walk away with a checklist, and you can figure out how, if, when you're going to implement some or maybe all of these changes in your practice. And with that, I want to say that I want to close by saying I'm very flattered to be invited to present to you guys and gals today. And hopefully you found this to be a helpful overview of some of the changes, maybe not all, but hopefully most of the changes that you need to make as you reopen your practice in the weeks to come. So thank you very much, and I'll turn things back over to Henry.
Chuck, thank you very much. Much appreciated. Great presentation. You covered a lot of ground. And surely you raised some questions as well. And so I'll turn to John Szczomak, because you talked about raising fees and surcharges that are relevant to COVID-19, and also trying to figure out break-even analysis for our clients who are in dentistry. And so, John, from your experience, how are our clients that you represent addressing these challenges?
Thank you, Henry. Basically, the safety and health of the dental team members and the patients is second to none. And in order to accomplish that, there's going to be additional time that's going to be needed to clean the operatories, clean the waiting room. And with that, there is time as well as cost. These costs are basically sterilization, antiseptic products, and additional protocols that have to be put in place in order to keep the safety and well-being of all our patients. There will be an analysis have to be done in order to accomplish that. The hard costs are pretty simple, as well as the time in between patients, because practice is not what it was. So we are able to do that and assist our clients and our friends with that. What I am hearing from various practitioners that in order to accomplish this, the surcharge will have to be put in place. Surcharges are basically being put in place in all different industries across the board due to the COVID-19. So dental practices are not foreign to that. So they should be in place to recoup these costs, to give the patient the greatest experience and safest experience possible.
Thank you, John. And Paul, as I turn to you, we've been in somewhat, I would almost describe it as a chaotic state with the relief packages that came from the federal government, multiple changes of law, and the SBA assistance with the Paycheck Protection Program and the EIDL program that existed prior to Paycheck Protection but was available as a relief. And a lot of it was designed to keep basically employees on the payroll. And now what I'm hearing, Paul, is that because of also benefits that have come through to the unemployment benefits, our clients are having difficulties, in some cases, bringing employees back on the payroll. And can you address this area, like from your perspective, what you're seeing with respect to clients that you take care of and represent?
Sure, absolutely. So first, I would preface that, Henry, with there are some of our employees who are legitimately afraid to come back and return to work. Perhaps are in a high risk group from a health perspective, and so we take that seriously and we respect that. There are others who, on the other hand, are frankly taking advantage of the system, and their response to us is, and to many of our clients, is that, well, we're making more money on unemployment, and so why should we come back? And what we're telling our clients is to explain to them that you're just trying to restart your business. This is your livelihood. You're frankly trying to survive in these times, and you really need them to come back. And if and by the way, you'll have a job in August after that extra $600 a month runs out. A week. And if they continue to push back, unfortunately, what we've had to recommend to some of our clients is that they offer to meet some of those costs, and perhaps we've suggested to them perhaps do it over time. Maybe don't pay them right away, but pay them that extra $600 maybe over time, over the next year or so they're kind of even with that. The one thing I will also say is a lot of employees have approached employers and said, well, why don't you just, I'll work, I'll continue to collect unemployment, and you'll pay me later. We strongly discourage that. There's going to be lots and lots of fraud perpetrated around this whole PPP and unemployment, and we strongly discourage our clients to get involved in anything like that. You're better off going to find another employee.
Thank you, Paul. I'll turn back to John, and perhaps Chuck can also help us with this area. We talked about prior to this webinar about how our dentist clients are still operating. Some of them are operating emergency services at maybe 20, 30% of capacity. And now you need to ramp up. and this must be sort of step-by-step process. And Chuck touched upon some of these steps. But John, from your perspective, dealing with actual practitioners that you represent, what are you seeing in terms of reopening of the dental offices?
Thank you, Henry. As Chuck mentioned, the office is going to have to be restarted systematically. And in so doing, some of the equipment may need to be replaced. The Internal Revenue Service has some great benefits for tax deductions for our dental clients and frankly all taxpayers to take advantage of. One is the bonus depreciation, and two is the Section 179 deduction, which allows the taxpayer to get a full write-off of all the costs associated with putting that equipment into play. The two things have to be done are the equipment has to be, a signed agreement has to be in place prior to December 31st, as well as the equipment has to be used before December 31st. These are key items in order to get this deduction, but in essence, the acquisition of this equipment will be borne by partially a big tax credit that the practitioner can play into the return, and the taxpayer would get the benefit of.
Thank you, John. Actually, when we talked about equipment, and again, Chuck covered some of it. Chuck, are you still with us? You are still with us. Great.
I've got another
I wanted to bring something up because I've represented pharmaceutical companies, and you mentioned that some of the technology exists among the medical professionals, but surely it exists in the pharma industry in terms of providing ambient air quality that's basically sterile. And some of those technologies, I'm sure, are being considered right now for sanitizing and disinfecting of the air quality. Have you had any experience in that space, Chuck? Can you address it?
We did have some. So we tried to bring some of these solutions to dental several years ago, and honestly, dentists at the time did not take it seriously, and they did not want to invest in it. So we abandoned that because we could only sell what people want to buy. We are now looking at more and more solutions. The good news is, if a pharmaceutical firm has to get to 100% sterile, disinfected air, a dental practice does not have to get that high. So what we're seeing is, pardon my verbiage here, but basically dumbed down versions of medical that will work very well in dental. And I think there'll be, I think total amount of investment might be $15,000 or $20,000. These are not going to be hugely expensive pieces of equipment, but I do think they will do the job we need done in a dental office. Plus, they'll make everything smell nicer too, so that's an added advantage.
Oh, that's terrific. And to John's point, the previous point is that the tax benefits that arise from getting the equipment exceptional in 2020. There's huge incentives, and the amount of deductions you can get, you can control. You can take it all. You can take some of it. You can depreciate it. So it's just a spectrum of benefits that need to be considered from the cash flow perspective and from the income tax perspective. Which brings us to the next topic. And we talked about the Paycheck Protection Program, IDO. We touched upon. We had previous webinars on it. We talked about also payroll tax credit based on 50% of wages with a limit of $10,000. And, this is a pretty complex area. So some of our clients, probably most of our clients, have applied for the Paycheck Protection Program loans. As I'm sure you listen to the news, how chaotic and crazy this got, and now how chaotic and crazy it's becoming due to the forgiveness provision. And surely getting people back on the payroll is important to kind of qualify for the forgiveness provision of the Paycheck Protection Program. John, from where you're sitting right now, obviously you have clients who have both gotten the money already, and yet the offices are not quite open, and they are not in a position to bring them back. And we know we have only an 8-week window to satisfy the forgiveness provision. How are they addressing it?
Thank you, Henry. The 8-week window is hard and fast. So some practitioners are bringing staff back in order to accommodate the cleaning and the sterilization of the office to get it up and running on a limited basis. This needs to be done, and it would be proper to get it done before that 8-week period exhausts so that you can get forgiveness of the loan. As far as the refundable payroll credit, as you mentioned, Henry, that is out there, but practitioners that have received the PPP loan under the SBA Act are precluded and are excluded from obtaining that payroll tax credit.
So, but the other side of it is that if you, for some reason, if you didn't qualify for the SBA PPP program, or if you simply did not apply for it, surely this is on the table for those folks, and it cannot be overlooked because it gives you a significant tax benefit from paying wages to your employees. We almost we're running out of time, but I want to just switch to Amanda for a second and kind of look at what questions we got from the audience. And by the way, before I do it, I just wanted to make a comment, since the webinar will come to an end shortly. To the extent that we have questions and we will not answer them right now, they're going to be circulated to the panelists, and we'll get you answers by email. And similarly, we're going to circulate some of the checklists and materials that Chuck was referring to all of the attendees who are participating in today's webinar. Amanda?
Yeah, so one of the questions that came up was to get input on whether or not you thought it would make sense for them to bring in an outside consultant to make sure that, one, the precautions that they have in place are compliant, and also if they should bring in legal counsel just in terms of any kind of liability.
Paul, would you like to take a step at this?
Sure. We have told a number of folks to do, in fact, just that. From the PPP perspective, certainly if they applied for and received the loan, we certainly suggest having a memo in the file and a perhaps even a tax attorney review it just to kind of bless it, and do that now while things and the reasoning for their application is fresh in their mind. From a dental practice perspective, same kind of thing, and we're in uncharted territory, and whenever you can have any kind of outside professional give you their input and their advice, we're recommending that. We're thinking it's a very good idea, and even as Chuck had mentioned earlier, to the extent there's even if you walk away with 1 or 2 points that you think are really pertinent into helping you start back up, we think it's a win.
And I would like to just add a comment to your answer, Paul. If I were a dental professional, and to address some of these issues, you could refer to your carriers for professional liability, for employment practices, the insurance coverage you have. The carriers often have a sort of a help desk or an attorney that's servicing the customers of the carrier, the insurance carrier, in providing useful, practical information on how to mitigate the risks associated with various areas of the practice. And I'm sure right now they are focusing on COVID-19 exposure, both on a liability side and employment practices side. I think we are out of time, so I just wanted to thank the panelists, Chuck, Paul, and John. Your presentations were excellent and much appreciated. I wanted to thank the audience for participating and joining us today. And I wanted to thank Amanda for hosting it and doing such a great job with it. Have a good day and stay safe.